So thank everyone for joining us for our ODRC Live Video Chat today. What we're going to be discussing is the new normal of prison and reentry ministry during our social distancing, time of social distancing. We are so excited to have Ronette Burkes with us today, Dr. Mike Davis from ODRC as well, and then Gary Croft, all wonderful staff members with us. For those of you who don't know, Ronette has served as she's the former warden of Ohio Reformatory for Women and now serves as the chief in the Office of Reentry. And her role is focused on engaging and energizing the external partners to create that warm handoff back into community. Ronnie's office also currently is overseeing those behind the scene operations that are going on with early releases. I knew, or I got to see Ronette in action about 3 years ago, and I was just blown away by the level of care she has for, at that time, the women in her care at Ohio Reformatory for Women. And I remember her saying that their number one role, their only priority was to save lives. And whatever that took to release women, to help women who come into the justice system and into the Ohio Reformatory for Women and help them see themselves in a better way, help them improve their lives, not only while they're inside, but also when they return to the community. And I'm being very committed to not releasing anyone into a situation where they would have harm. And that really spoke to me in significant ways, and also helped us to craft for our All-In Community Initiative with the West Ohio Conference, helped us to craft our women's ministry with incarcerated women. And we also have Dr. Mike Davis and Gary Croft with us today. I got to know them. It's coming up on 4 years that I have been under their tutelage. They have been amazing mentors to me, and also, to be honest, in crafting our West Ohio Conference measured response to reentry, to prison ministry, and also to victims. And so it has been a real honor and privilege to work with them over the past 4 years. For those of you who do not and are not familiar with either Mike or Gary, Mike now serves in the role as a chief for the Office of Religious Services and Recreation. And in that role, he oversees all of our prison chaplains and also the volunteer efforts. Volunteer coordinating comes from his office. And then Gary Croft, who is the most decorated person in the ODRC, just always have to put that in there. I can see he's smiling, going, oh, not again. He serves in Ronnie's Office of Reentry as the Faith-Based Initiatives Coordinator. And his efforts really are to link faith-based assets and efforts to serve the men and women that are incarcerated in our prison system. So we are going to, oh, sorry about that. We are going to then just get started with some questions for them. And again, thank you so much, Ronette and Mike and Gary, for agreeing to be on this call and for doing this with us today. So we're going to focus on 3 primary areas. One is providing navigation tips for our pastors and family members and faith ministers who are walking with incarcerated people. As we know, things have changed, right? And they're going to continue to change. We're going to continue to churn in uncertainty for a while, but there are some things that have remained. And so we're going to have some discussion around what this looks like in this as we move toward a new normal. We're also going to have some discussion around ODRC faith-based volunteers and suggestions for those of you who are in that particular role of ministry, to how do you remain engaged with the group participants that you were working with prior to the closing of facilities for visitors and for programming. So what is that going to look like? And then shifting also as our institutions are limited in how we can minister to folks at this time, how can we shift our ministry focus and our energy from inside in-person ministry to reentry and community ministry efforts? And so again, we are going into a new normal, but what is exciting about this time is we have the opportunity to shape new narratives and new ways of ministry. And as we bring ourselves and offer what we have in partnership with our Department of Rehabilitation and Correction, I truly believe that we can create some amazing opportunities for transformation, restoration, and rehabilitation. And that's what I love about, I always tell our groups in West Ohio, we are blessed to be living in Ohio and have agency leaders like Ronnie and Mike and Gary and Director Ronette Burkes-Trodswell who are not only focused on rehabilitation, but also on restoration and redemption. And those are important components. I know in just getting to know Mike and Gary and Ronnie a little bit is that's how they walk their faith out in their work. And so we are incredibly blessed to have that kind of leadership leading us through these uncertain times. So I just want to start with a couple questions. And a couple of these came because I've gotten requests from pastors who have an incarcerated person. And one of the questions was, we need to notify somebody inside that there's been a death in their family. And how do we do that? Right, just these kind of simple things that used to be just standard. So if one of you could take that perhaps of what is the best way to initiate, death notices or things that are happening in the community or in a person's family that is incarcerated, what is the best way to communicate this kind of information and news to them? And I'm just going to throw it open to one of our three guests.
Has Mike joined the line? Because that's his staff actually do that. So just wanted to make sure Mike was on.
I'm here. I'm still getting caught up on technology. Everybody, I didn't realize I was actually muted. So I gave the answer, and now let's move on.
Hey Mike, just to let you know, your tagline says Ronnie Burkes-Trodswell, but that's
okay.
Everybody.
just to clarify everything for everybody, I am not Ms. Trousdale, but I am Mike Davis, and good afternoon to everyone. I saw names pop up that are very familiar. Would much rather see you in person, but under the circumstances, happy to see and hear from you today. Just real quickly, Reba, you mentioned some things remain the same. And so this is one that remains the same. That's why I jumped on this question so eagerly, because if you are faced with a circumstance where you have to notify an incarcerated loved one, congregate, parishioner, or whatever have you, of the death of a loved one, serious illness of a loved one, the warden's office is still probably the primary point of contact for you. If you don't know the number or not quite sure the specific extension, you could always call the general number of the prison and be directed to the warden's office, and then search on our website. You could look under the specific institution where there will be an email address to the warden's office, as well as a phone number. The other point of contact, the chaplains are also available to you. So the warden's office and then our chaplains would be the pathway for sharing that information.
And kind of in tandem with that, Mike, if somebody wants to check on the health and well-being of a church member or a loved one while they're incarcerated, is it the same pathway?
That would be the same thing. Yeah.
Okay. All right. So then how have how can our pastors and our members and our family members continue to provide support while visitation is suspended at this time? What are some recommendations you have for that?
Well, so and again, because the support has been so varied over the years, a lot depends on what was being provided previously. So persons who are visitors who are authorized to call and make contact, to communicate via letter or JPay, all those things can continue as they did before. I think the big difference is for those who were or are categorized as approved volunteers with our agency. And so you were running a program, everything happened, the program was postponed, discontinued, in hiatus currently. How might you continue to offer encouragement and support to those who are incarcerated? My current suggestion is that you contact the institution chaplain to discuss the ways in which you can message to that group that you were engaged in support of. So the chaplains are still functioning, they're still operational. They still have the tools and the capacities to help you continue to provide support, words of encouragement to those who are incarcerated. Things that are not permissible, the chaplains will advise you and make you aware of those things that they cannot do.
I just also wanted to just jump in and just share with everyone that last week a proposal was submitted to our director's office from the Office of Reentry in regards to resuming visitation and what that would look like. So our director is very excited and wants to be able to resume visitation, but she wants to do it in a way that's safe, certainly. And so some folks got to put together a plan to submit. And hopefully we'll be hearing something in the next few weeks. We don't know when that visitation will be resumed, but certainly those things are being really carefully planned. So thank you.
Are there some communication tools that are inside the institution that are kind of being ramped up or have been ramped up to help family members remain connected during this time? Anyone?
Sorry, I was trying to get some. Oh, go ahead, Mike. Because I'll just jump on the what you say.
Say again, those individuals outside of the approved volunteers. Here.
Hey, Mike, you're breaking up. You're breaking up. You need to slow down your talking.
Okay. So those individuals.
This is the joy of conversation. Okay. So Ronnie, maybe you could kind of jump in on that because I think Mike had to get off to get back on.
Okay, sure, no problem. So one of the things that, and our director certainly and the team at our headquarters really worked hard to try to figure out ways to keep people connected. And so one of the things that our department has done, I think as probably most people know, is to allow folks to have some, I'm sorry, I'm getting a delivery and the delivery guy is talking, so I apologize for the background noise. But to allow folks to have some additional ways to communicate or some additional time to communicate via our JPay system. So I think that many folks know that folks are able to make phone calls home. So we're giving folks additional phone opportunities to be able to call home. In addition to that, our agency also gave folks additional free video calls that they can call home and actually have a video face-to-face meeting with someone and with family members. And we have done some other things in regards to ensuring that folks have the proper having paper, having stamps and things like that to ensure that people can write home more frequently as well. And so with the phone calls, the videos, the additional stamps, things like that, those are all things that have really helped people be able to communicate more with their families. And I think that was important. One of the things typically, if you are in some sort of restrictive environment because of a behavioral history or issue, those kind of things were limited, but I know that institutions have lifted those things as well for people who have been in restrictive environments, if it's safe, to be able to do so and to allow people to communicate with families. The families are very, very concerned about their loved ones. Our department also instituted a COVID helpline, and that helpline is a number where anybody can call, really, but family members can call and just get information. One of the things that was important is that we get as much information out there to help dispel some of the rumors. The rumors certainly are still there, but this, our hope is that this will help dispel some of the rumors so that folks are getting good and clear information about what steps we're taking. Also on our website, you'll see some additional information about COVID. Our daily updates are on there. And we also have updated resource information.
That's great. That's great information to know. Because I know prior to COVID that one of the main focuses was family engagement for the ODRC. And so it's good to see that those kind of measures are coming up and are in place. So I want to shift just a little bit and probably a little more to Gary's area as well of faith-based volunteers and suggestions for remaining engaged with their group participants. And Mike touched a little bit on that with Bible studies and things. But what are some of the ways that you are seeing ministries and programs, whether educational programming or life skills programming that are being worked through during this time when in-person work isn't happening? Gary?
So did Mike make it back on, or?
I don't know. Mike?
Oh.
I'm here.
Okay, he's back. Sorry.
Mike, I can probably mention Life Builders, just that one particular group, but you could probably do a better job from a global standpoint on what's going on in the prisons in that respect.
Okay.
Okay.
So Gary, how about if you start by talking about what you're thinking through with Life Builders, what that might look like?
Well, what we've done, we have a Life Builders group at Chillicothe Correctional Institution. Actually, it's some brothers from the United Methodist, the West Ohio Conference, and so they've worked very closely with the unit staff on that unit to where they're actually doing the Life Builders program. And so when they weren't able to come back in, they worked very closely and got permission to still maintain contact in a very structured way in terms of getting the Life Builders, the materials that they were working on with that particular group into the men for them to work on. And then there's been some correspondence, but all of that was coordinated very closely, very carefully in terms of the approval through the unit staff and I'm sure through the warden at that particular institution. So that's what I've seen with Life Builders group in particular that I oversee in the prison.
Okay. So Mike, your recommendations, suggestions for how programming?
Yeah, I would just, I guess, piggyback on what Gary said. The standards of conduct for volunteers prohibits unauthorized communication with men and women who are currently incarcerated. So any attempts to make contact outside of the boundary of volunteerism or outside of approval from DRC staff is still prohibited. So communication with the chaplain, clear discussion and articulation about what that engagement might look like, and then sort of a review, and then pending approval from the chaplain could continue to occur. And so if there are aspects of a program that our volunteers would like to share, to continue in some way, again, that the chaplain is going to be really the gatekeeper to initiate that engagement along the faith-based track. And certainly, I think that would be true of the unit staff as well.
So it is a matter of individual organizations contacting the institution that prior to COVID had approval to be working inside, and then working through what it would look like for remote.
Yes. And Reba, just let me, I'm sorry, I just want to add that we'd be more than to be a part of any of those discussions. If people in our listening audience want to kind of go over what they might propose to the institution, I think Gary Croft and myself, Deputy Director Burkes, we'd be more than happy to help you maybe shape or frame what might be approved, or at least enter into discussion along those lines.
Okay. Are there plans in the works for virtual group meetings? Does that make sense? Where you instead of kind of individual, an organization touching base with individuals, but are there plans in the works for some more of the reforming into kind of group things? Does that inside? Or are we still working towards more social distancing within the institutions? Okay.
Reba, yeah, it's hard. I can't see Gary running it, but I guess from my position, we're still working through some things. There are just a lot of from the chair I sit in, a lot of unknowns about aspects of our future work. So I don't know. I guess is the short answer. But we're entertaining all proposals, all discussion. For a volunteer, for example, to want to contact an individual specifically, it is really part of the reason the unauthorized contact is prohibited, because that sometimes could be a trap for the beginnings of unauthorized relationships and engagements. But when you're say a program facilitator working with the group at large, I think that's more in keeping with the way things have been historically, and the way I would envision things moving forward.
So just as we're on this Zoom platform here, do you envision, or is there even the capability within our institutions for me to be sitting out here and then to have a group like we have right now inside the institutions?
So Reba, I was going to jump in. Mike, unless you were going to say something else. I don't want to.
Go right ahead.
I was going to jump in and say, I think that we are certainly going to be operating under what we call a new normal. And none of us are sure what that looks like. But I think we're all certain that we're going to have to look at other platforms to bring in some of the programming, bringing in and doing some of the things that we've done in the past. And so recently, actually today, each section had each deputy director had to submit their plan for their office to basically to return to work in a sense more of back to normal under this new normal. And so what that means is that each section had to come up with a plan for their office, and it may have meant for most of their office to be working out of the office from home 4 days a week, and then the office 1 day a week, rotating with other sections. So how can we come back to normal in a sense, but do it in a way that's safe for everybody? And I think because our director asked each section to do that, they also will be looking at ways that we can deliver the same services, but in a different way. And as many of you know, I noticed that some of our community partners are on the phone. I saw Sean Stover from our Reentry Coalitions, and Diane Bricker, and some of our other folks that we work with on a daily basis. I saw Renee Womack and Madeline and Chris Money, my favorite warden. I have to say, Chris Money, I always said Chris Money was my unofficial mentor. I don't know if she knew that, but I certainly deemed her as that. But we're going to be looking to you all to give us ideas of how we can make that happen. Certainly, we were not necessarily prepared or set up for this to occur, but I think what it has done is it really has opened the eyes of our department to look at technology and how we can best utilize technology. So we don't know if that'll be a Zoom platform. Right now, we are using a platform called Microsoft Teams for our staff. But keep in mind that we have to be able to do this for 28 facilities, and then it has to be able to basically connect with whatever the community is using. And we just can't take necessarily the first person that bids something like this. If we decide to put out a bid for it, you know, we have certain rules and regulations that we as a state agency have to do in order to do a contract with someone to have a platform for our facility. So I will tell you that I do certainly believe that we're going to be looking at different ways to do things like this. We've done some things like this. We have educational classes right now through Ashland University, where the men and women actually do remote classes via tablets. So we've done that. As many of you know, some of you have participated in what we call video inReach, where you actually inReach into the facility and share information about your agency. We do that monthly through the Office of Reentry, and that's through our video conference program. And so, you know, that may be a platform that we're used. We don't know what that platform is going to look like. I can tell you that we're going to be definitely doing some things. And our director has, today she's participating in a town hall with some folks in the city of Cleveland. We're actually organizing another town hall that she's going to be participating in. We've done a lot of conference calls. So I think that what this has done, unfortunately, it's hurt so many people in a negative way, but I think we can have some positives out of this and really learn how we can best utilize electronic platforms to reach people. So you probably won't see the amount of people that you were seeing coming into the facilities, because we certainly want people to be safe. But I saw somebody put in the chat that they have ideas. I know at some point we will be seeking ideas and looking for ways that we can do things, but we have to ensure that we're in compliance with all of our state regulations as well.
Okay, great. Thank you so much. Thank you both so much for that. Whenever we think about relaxing visitation, do either of you have a sense of priority? You know, family members first with visitation, then you know, volunteers or contractors, or you know, how do any of you have a sense of maybe how that will play out?
I don't think any of us do, because we don't even have a plan for employees to really return back to work, and
Okay.
that's essentially what was submitted today. But I can tell you that families are priority. We know the importance of families and having a healthy family connection with your family. So we are, I do believe that families will be a priority in all of this. So
Great, thanks. I think this perhaps is a question for Mike. So get ready.
Okay.
because having known Mike for the last 4 years, I know that he kind of likes to put his finger up to see which way the wind is blowing sometimes, right? You know, he can kind of project out. What would you recommend some of our organizations that are on this call maybe start kind of thinking about or considering in shifting their practices so that they can continue to participate at the level that they've been?
Yeah. Yeah, Reba, certainly. And because of, you mentioned Ronette's experience as a warden, and certainly Mr. Croft as the most decorated man in the history of our agency can attest to in his various leadership capacities. Our agency, sort of prior to all this, we probably had at our height maybe 10,800 active men and women listed as volunteers. The majority of them coming into our facilities. The challenge for staff, particularly the chaplains and others, is really sort of the issue of capacity, space limitations, and just trying to figure out schedules to allow maximum levels of engagement. And those things, while posing significant challenges, also sort of direct people away from some other significant issues and challenges for men and women who are currently incarcerated, and that is their transition back to community. And one of the things I think over time we've seen is that while a lot of people come into our facilities and do a great job, we love having them in, as Ronette mentioned, we also need them on the outside, helping people transition, helping them establish connection to community and be fully integrated in the fabric of the local community. And so I think right now, it's a good time to sort of say, hey, can we establish sort of a two-pronged approach to develop or maintain a reach in and establish ways in which we can assist in that transitory period and help people on the outside just as equally to engaging prior to release.
Gary and Ronnie, anything to add to that? No? Head's shaking. Okay. So Mike, and also Gary and Ronnie, I think one of the tensions for our groups may be the whole piece around appropriate volunteering, appropriate guidelines, and how do I, as a volunteer, an approved volunteer, maintain that status, but then also work in the community with that person or even another person coming back, and not in a way where I'm not going to compromise my volunteer status. Because I think sometimes there's the perception that we can't have contact with people who've been incarcerated on the outside, because that will jeopardize my status on the inside.
I guess I'll just jump in first and just ask Ronette and Gary to jump in. I think the big thing is transparency. So where I've seen issues, it's been in a lack of transparency or communication with the institution, with those managing officers, or with the the wardens or the staff. That lack of transparency, and then also the Nexus form is designed really to share information about sort of relationships that exist, that previously existed, or are developed over time. And so often those avenues are not gone down by those who are seeking to expand service or where they're trying to continue or maintain service. So I would say communication to the site supervisor, and then also maintaining or updating the Nexus form should take care of a lot of those issues.
Oh, great. Yeah, because one of the questions here is, can we do both inside work eventually and be able to work with those under PRC?
Mm-hmm, mm-hmm.
Right, and
yeah.
that's
so that transparency, the communication, and then some of it's going to I think come down to what actually is occurring. So a lot of it will be case by case, as it comes up. Yeah.
Okay, great.
And we do have several community partners that do that already. Certainly Embark with Chris Money and her group, they work with the women while incarcerated, and then and men, and then transition into the community. And I know that there are other organizations that do it as well, that have volunteers that come in, and then they also help transition to them. So they, in some cases, some volunteers don't necessarily work with them directly on the outside, but they hand them off to somebody else in their agency too. So like Mike said, I do think it is certainly an individual basis, and but we can help with some of that structure, or some of that how you can do it and still be in compliance with our policy, because it's always good, and we certainly want folks to have those connections in the community, but we want them to just be appropriate.
Okay, great. Thanks.
Yeah. And I would add, summarizing it all, is just ask. Whoever your point of contact is at the prison that you work through for that particular program that you come in to do, run all of that stuff through them, and just simply be very upfront and communicate openly with them about what it is that you're proposing to do, and get direction from them. And so don't be afraid to ask. It's not a stupid question or anything like that. Just ask and just and communicate openly. Yeah.
I certainly know you all have been very open as we come to, this is what we'd like to do. This is what I'd like to do, or we'd like to do, or we have a pastor that would like to do something. Help us navigate that and figure out how to do that so that we get to the same end goal. So I can attest to the openness to innovation and new ways of doing things. And I think particularly now, all of us have to be in that space of innovating and working towards this new normal. A couple questions that have popped up. Will, some of our institutions have been more heavily hit with the virus. Will plans for the return of volunteers be the same across the board, or are you all looking at as gauging each institution and letting them develop their own plans for when the time is right to allow volunteers to come back? Is it based on kind of one general plan for ODRC, or is each institution going to have the latitude to decide when to have volunteers return? That's the question.
Yeah, I don't know, Reba.
Okay, haven't gotten there yet. Okay.
I was going to say the same thing, that I don't know. I know that institutions have been stepping down we have different phases during this COVID-19, because we're operating, just so folks know, under what we call a critical incident stress management system, critical incident management system. And so we've been operating like that since early March, when this was first announced. So we have institutions at different status levels. And so although institutions have been stepping down to different statuses, the highest being a red status, and then the next the orange, and so on. And so we've been allowing institutions to make plans to reintegrate some things back into their practices or their daily routines, such as OPI has opened up at a couple of our facilities, which is our Ohio Penal Industry, that helps. We make all kind of things that help our institutions function. And so that's been all based on the status of those facilities. We don't know if it's going to be the same for volunteers or not.
Okay, great, fair enough. Another question, and maybe this is an idea even going forward, is could the visitors room be used by volunteers who connect to prisoners located in the chapel through Zoom? That sounds like an idea to me.
It sounds like it's worth hearing more about.
Yeah.
Yes.
Currently, DRC is not licensed to use Zoom, so we can't initiate a Zoom meeting, but as you can see, we can participate in one. We're licensed to use Microsoft Teams at this point, but again, I think that I think this is the time where all of your creative juices can flow and you can throw out ideas. I always say we look for ways to say yes and not ways to say no. And good ideas come from everyone. They don't come from just because we work for the department. I can tell you, we don't know everything. So we certainly, a lot of things that we've been able to do across the board and implement in our agency have been because of folks like you.
Okay.
Yeah.
All right.
Hey, Reba. There is on our website, actually, in Ronette's shop, there's a reentry program proposal form. And so people who have program ideas or project ideas, I don't know, Ronette, what do you think? I would suggest that you go to that and fill that out and submit it. You know, it's a good way to start communication and start engagement with our agency about some of the ideas you might just have.
Oh, great. Thank you. And that's under the ODRC website, under Office of Reentry?
Correct.
Okay. Under Reentry.
Mm-hmm.
Gotcha. Okay.
Yeah.
This is just a quick question. Are Nexus forms approved at DRC Central Office or at each institution?
They're approved at each institution, so it's only forwarded. One would only be forwarded to our headquarters, to the chief inspector's office, if there was some huge concern that the institution felt like they couldn't address, or some like if something came up or something sparked some sort of attention. But that's very rare.
Okay.
Yeah. Hey, Reba, I just wanted to say too, because I've talked to people who've been, they fill out the Nexus form, and I just want people to know there's no sort of stigma associated with having a previous connection or family member who's currently incarcerated, who's previously been incarcerated. We are among all people most comfortable with that reality. There are staff members who have, brothers or cousins or uncles who are incarcerated. The idea, though, is to share, and the sharing provides protection for both the volunteer, the staff, and the person who's incarcerated. So I just want to make sure everybody's clear that the Nexus form is not a bad thing, but it's again another level of high-level communication, so that we're all operating on the same plane.
Okay. And can we just make the distinction, because there is a volunteer application, which the Nexus is part of, but it's not the full application, correct?
Yeah, it's a part of the documentation you'd be asked to fill out as a volunteer, and if your application has been processed, and so it's gone through and you're approved. Say your next door neighbor goes to prison, and they're at a facility, and that's a person that you need to then update your Nexus form, and you would do that through your site supervisor, say the chaplain, for example. Let them know that you need to update your Nexus.
Okay, great, thanks. So I want to pivot back again toward this whole thing of reentry. And Ronnie, your office works with the community stakeholders all over the state. And I know we have some, like Sean is on the phone and some of our other folks. What are you seeing happening in that space with the reentry coalitions? How are they operating at this time? How are they kind of becoming more innovative in some of the things? What are you seeing happening in that space with reentry coalitions and reentry efforts in the community?
So I just have to say that our reentry coalitions have really truly been amazing. We're doing biweekly meetings with the reentry coalitions through the local association of reentry coalitions, and to update them on what's happening with DRC. And one of the first things that happened with our reentry coalitions and our partners, folks began reaching out to us, providing us with their status. And so what that means is they're letting us know if they're open, how they're operating, if numbers have changed, those kind of things, and how folks can reach out to them if they need assistance. And so we've been able to keep basically a biweekly update of reentry coalitions and how they're operating, what their current status is. And that's also on our website. And we've also provided that information to returning citizens who are coming back into our community. So I thank Sean and Diane and some of the other reentry coalitions for what they're doing there. You know, it certainly has been challenging, I'll say, and I think challenging on different levels. Our reentry coalitions reached out immediately wanting to know, number one, what they could do to assist, but also letting us know clearly how we could assist them. I think one of the biggest challenges has been, especially particularly for coalitions who help to connect people to housing, our housing partners want to know who's COVID positive. And unfortunately, DRC is not allowed to provide that information. So we quickly went into gear with our legal department, and it took a little bit of time, but we were able to connect with Dr. Acton and the Ohio Department of Health's legal team, our legal team, to come up with a way that we can not necessarily disclose somebody's COVID status, but we could let our community partners know this person's under a quarantine order. So that's something that just happened recently because Sean, as Sean knows, and Diane has been on the calls with us, we've had partners, you know, every call want to know how can they get the status from us because it's important information for them to have. So we're working through things like that. The coalition partners have shared with us other ways that we could help to assist them during this time. And so just providing them with the information on who's returning to the community. We were already providing release information, but one of the things that came up quickly was information about who's on the list. The list, when the governor mentioned the list on that press conference, you know, after that, everybody wanted the list. It was like hot thing, like the hot ticket. And so, but what we've shared with our partners is that not everybody on the list, on both lists now that we have, are going to be released. We have a number of people who won't be released because they don't meet all the qualifications or things have happened, but making sure that our staff connect with reentry coalitions in the communities and let them know who actually is getting out when we have that information. So we've been trying to do that as well. I think our biweekly calls have helped probably our department even more because we're hearing from the partners what the need is, you know, what they need out there from us. And Tom Lukey and folks have provided us with information about quarantine centers across the state because as you all know, here's the reality. We have some people who are coming home who are under supervision and we have a little bit more authority, well, a lot more authority over those folks. We have authority to say where they go, you know, what their approved placement is, things like that. But we have a number of people who are coming home that are, their time is ended. You know, they have no legal obligation to us at all. So essentially they can leave and say, I don't have to tell you where I'm going, you know, you have no control over me and things like that. And those are some of the more challenging people because if they leave and they're COVID positive, so we're not releasing anybody under the emergency release that's COVID positive, let me say that. So if they're on the emergency release and COVID positive, our director's not going to release them. We worked with the counties, the judges for those people who are COVID positive that they want to grant judicial release to ask the judges to give us at least 14 days to quarantine those people in case they test positive or they have had contact with somebody who's positive. So let me say that. Now, for the folks who are not going to be under any community supervision and their sentence is simply ended, that quarantine order does help us because it legally obligates them to quarantine and it legally obligates them to tell us where they're going to be and give us contact information for somebody else in the location where they're going to be and some number of other things. So I think that certainly has been helpful. And then I can say this to kind of summarize what I'm saying or to wrap it up is that our community partners, our coalitions have been just phenomenal with getting us assistance with making sure that folks have what they need when they leave prison. So if somebody has to go into quarantine, they're not under supervision, we are quarantining them, we feel an obligation to make sure that they have food. We're saying you have to stay in this quarantine location, you can't leave, but then we can't just leave them there without feeding folks. And so our coalitions and other community partners have really stepped up. Our faith-based based leaders and organizations have stepped up as well to help us ensure that we're able to provide meals to folks or quarantine boxes. And we've been doing that across the state. Gary actually has been working on that. So I'm sure there's so much more we could be doing. And I think as things come up, we begin to explore those avenues. We're working heavily with our managed care plans. We found out, I don't know how many folks know, but if somebody has Medicaid and they are under a managed care plan, one of the 5, the managed care plans will help provide a quarantine for those folks. They'll pay for quarantine for those folks in many cases. And then they also help with they call it non-medical related support, which looks like food, which looks like PPE gear, which looks like all those different things. So we appreciate the partnership with our reentry coalitions.
And where can our people on the call find a list of contacts for their local reentry coalition?
So we can provide you with that information. My office, and I can, Reba, I can get it to you.
Okay.
Have you send it out. We can give you information about the local reentry coalitions, citizen circles, and then the contact list for our office. We've been, I say we can't stress enough that our institutions need to reach out to their own resource, which is our office right here in DRC. And I just had a meeting with a warden this morning about that very thing. This weekend, there was a situation that occurred, and the staff did not, and it wasn't the staff's fault. The family basically on Friday had planned to pick their loved one up Saturday, and he was COVID positive. He was going home with his family. Well, between 10 p.m. and 8 a.m. the next morning, the family decided, we're not going to come get him, and you got to find a place for him to go, and he had to be released by Saturday. So we're really encouraging the institutions to utilize the internal resources they have, because we have connections to folks like Sean and Diane and Chris Money and all those folks who have connections to other folks. You know, Reba, you have connections to so many different people. And so, and our institutions sometimes don't realize what resources they really have at their fingertips if they just pick up the phone.
Right.
So.
Yep. Okay.
Hey, Reba, I just wanted to jump in real quick, and I know we've all sort of talked about this before, but Ronette makes the point when we talk about a two-pronged approach. I think for local faith-based organizations, for congregations, pastors, I think it's a good idea to connect with the local reentry coalitions and find out maybe how the local faith community can support the endeavors, the initiatives, and the missions of the local coalitions, and maybe fill in some gaps because, as Gary said, you know, the faith community comes with a tremendous amount of resources, knowing, and expertise that isn't always sort of laid out as they engage inside of our prisons, but certainly can be a force multiplier in addressing needs and concerns when people are coming back home.
That's right. Great. Yes.
Hey, Reba, I have to mention this. I just saw it come up in the chat, and I don't know why I didn't say this, or Mike or Gary, because we all know about this. We rely also very heavily on relink.org, and Bethany from Relink is on this group too. They really have a comprehensive website of resources. And not only do I use it with community partners and use it with our institutions and the folks that we serve every day, I've referred my family members to relink.org because the information on there is just that comprehensive. And it's our hope that in the future, we can, hopefully this COVID didn't slow it all down, but we have a plan in the works that we can get relink.org on all of the tablets of the men and women in our facilities. So hopefully that's something that we can continue to move forward with, but that's something we have been working with them. But we just believe in relink.org that much. So I'm sorry I failed to mention that.
No, that's great. And
I bet.
Yeah, and it reminded me that we actually did a webinar with Bethany as well on how to navigate relink.org, and that's on our All In Community website under resources. So I will, at the end of this time, or following this time, I will send out links to a lot of the things that have been mentioned, including Relink, where to find the reentry contacts on the ODRC website, I think actually Jamie G from Montgomery County sent me the list of resources that your office, Ronnie, put together that talked about, you know, what the coalitions are doing and community partners, how they're engaging, how they're open, how they're taking new clients. I'll send that information out as well to the group. So yes, we had one question that I did not get to yet. It is, will we, or, and again, this is kind of finger into the wind or looking up upon the horizons, do you think that we will have volunteer resident contact, face-to-face, in-person contact prior to a vaccine?
That's an excellent question, and actually, it's one that I was in discussion with my pastor about. You know, with the recent announcement that houses of worship will be sort of reopened, along with other things. How do we do that safely? When do we do that? And what that looks like? I don't think we know in the community. At least the one in which I reside in, and I think as we've alluded to here, we don't know how that might look in our institutions. But certainly, I think we all agree that we need our volunteers, and your support is critical to our agency accomplishing its mission. But the ways in which we do it might need to be different. So more to come.
More to come. All right, great. So it's 2:04, so we're about 4 minutes over. I really wanted to try and keep this to an hour, but at the same time, are there some things that questions that the participants have that haven't been answered, or any thoughts that you have that you would like to hear more about? So if you do, you can unmute and ask a question. Please be respectful of everybody else. And also you can do it through a chat. So Mark, I see that you're trying to ask a question, but I can't hear you. No. No, still can't hear you. Sorry. Can you type it, Mark? Yeah, Mark. Sorry. Anybody else? Mark, if you could type your question. Thanks. Anybody else have a question, verbal? So as Mark is preparing his question, final thoughts from Ronnie, Gary, Mike?
I'll always tell everybody is what I've always told them is please just continue to keep us in prayer. Keep our leadership, our director, Annette Chambers Smith. We've been blessed with great leadership, and so we thank God for her. But keep her in prayer and keep our leaders in prayer, and certainly keep the men and women that we have charge of in your prayers. God bless you.
Thank you. Ronnie or Mike, any final thoughts?
I was just going to say, and I thought about this when Gary said what he said, but I just wanted to publicly say this and thank both Mike and Gary for their leadership. I don't know if folks on this video know that every weekday, Mike and Gary lead a call of anyone who wants to join from our agency to pray at 7 a.m. So at 7 a.m., they heard the director say that at 7 a.m. every day she prays for our agency. So they led the charge with starting a prayer call. And every day we all join together as a community and we pray. And we've had different folks join us, former staff, pastors and bishops and imams and and priests from our community lead us in prayer. And but they also both have led us in prayer, as well as some of our other leaders in our agency. And I think that I think they know, but I really don't think they really truly know how much that has impacted our agency and the people that we work with every single day. I have received so many just emails and folks saying thank you for that leadership. So to my deacon, Deacon Croft, he's actually my deacon at my church, and to Dr. Davis, Mike Davis, I just want to thank you both, because I think that it's a great way to start our day, not only praying individually, but coming together as a group and as a department and as a family in prayer. And you all have led that charge. So I just wanted to say that in front of everybody.
Okay. Thank you.
Yeah. We did have one question. The reentry coordinator for Clark County, how can she get involved in the bi-weekly meetings you were talking about?
So Diane Bricker is on the call, and actually Diane actually sends out the emails, invitations for that. So if you either put your email address in the chat or send it to me or Diane Bricker, we can ensure that you are on our calls, and anyone is welcome. We want to make sure we provide enough information for everybody.
Great. So Kathy Harrington says, thank you all for your grace-filled work. Yes, Dr. Davis.
Kathy, we appreciate you. I just wanted to say thank you, Reba, for hosting this, and I hope we can do it again. And just on like a parting note, I guess one thing that this circumstance has sort of put under the magnifying glass is sort of the disparity and inequality that exists in our communities relative to service delivery, access to service, as we look at who's impacted by COVID and some of the other circumstances that exist relative to housing insecurity, food insecurity. And so I think it is an opportunity for the faith community, for our other community partners, to really engage in efforts to create a narrative for other leaders to better understand the intentionality needed to address the needs, issues, and concerns of the returning population. That success relative to reentry occurs beyond the gate. Preparation for success starts inside. Transformation can occur inside, but whether we win or lose occurs outside the fence. And so we appreciate you all. And again, thank everyone for listening. And Reba, thank you for your compassion and passion for this issue.
Well, thank you so much, Mike. And I think on that note, how about if we do the same example that the ODRC is doing, and let's just join in prayer before we close, and pray over our staff at ODRC and also each other, right? Sometimes we forget to ask for our own prayer. And before I do that and lead us in prayer, I do want to thank Ronnie and Mike and Gary for giving of their time. I know you all are extremely busy. You've got a lot on your plate, as we all do. But a lot of us don't end up in the paper, right? Our agency's not in the paper a lot, so, or setting national trends, not in a good way, mind you, at this point. So we understand that your time is equally as valuable, and we so appreciate your willingness to step into this space of authenticity and vulnerability and transparency. So thank you for that. So if you'll please all just join me in prayer, and then as we leave our call today, know that God is always with you. Sometimes even when he's silent, he's always with you. And so thank you for your passion and your work and your faith in living and walking that out. So if you'll just join me in prayer, and then be blessed for the day. Most gracious God, just thank you for everybody on this call today, on this conferencing, Lord. We know that you have been with us because you promised that where 2 or 3 gather, you are there. And we have felt your presence in the conversations today. I know I have felt just the hearts of everyone on this call and how they ache for those that are incarcerated, how they ache for those that work within the system, Lord, in this time when we don't know what is going to happen, other than we do know that when we put our faith in you, that you are always working in the background for the good, and that as we get better in delivering the services and building relationships and helping to transform lives, Lord, that we can only get better whenever we see what you are doing. And so, Lord, I just pray that everyone today is touched by this conversation and are touched by the amazing things that you are doing through innovative thoughts and ideas and plans, Lord. And we know that it will all be for the better of our kingdom. We ask this in God's most holy name. Amen.
Amen.
Amen. Thank you. Thank you all.
Guys. Take care.
Be blessed.
All right, you too.
Bye.